live forever? Why do you want to live longer? Is it because you're afraid of death?
She was recognized for her contribution to the field of regenerative medicine and named Stem Cell Doctor of the Decade. That's pretty awesome.
One of my favorites is peptides. Peptides are powerful new signals that we have discovered.
She is a UCLA-trained triple board certified physician. That's by the American Board of Psychiatry and Neurology, the American Board of Addiction Medicine, American Board of Anti-Aging and Regenerative Medicine.
So when we put that code into another human being, we are infusing intelligence, and that intelligence can guide the body in repair. That's why it's so exciting. Yes, it can become any cells in the body, but it's really the intelligence that these cells can transfer to the body.
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better. Well, actually, so you and your friends can live beyond the norms. Dr. Kong, thank you so much for joining us on this talk.
Thank you so much, Chris. Really appreciate it.
All right, so I wanted to jump in right on the first thing, right? This is a longevity summit. I'm guessing you're familiar with Dr. David Sinclair and his information theory of aging, right? He believes that we can live a lot longer, maybe forever. Where do you sit with this theory in the prospect of living forever?
Well, first of all, I have philosophical viewpoints about this. This is, I think, why do you want to live forever? Why do you want to live longer? Is it because you're afraid of death? Or is it because you want to keep learning and keep growing as this particular entity? What if you have a different spiritual viewpoint? What if you think that you never die, that consciousness never dies? So why are you so attached to this one particular body? To me, I'm not that attached. But while I have this body, I would like it to have a really good life, vibrant, active, enjoyable. But I don't personally see the point of living forever. I think we can, or, living super long. I'm perfectly happy to move on to the next form that I'm going to take on. It's the natural, I think, evolution of the spirit. So that's not really talked about in the longevity space. I think people are so focused on just living long. I think living as long as possible and while being healthy, that's a good goal, because by living long, usually you are prolonging health. Otherwise, you're not going to live very long. So I think just for the health pursuit, that's a good direction.
Do you have a personal target age and or a target age for your clients? You're like, hey, I don't know, I've had a goal of like 125 for a long time. Are you there, or you're just like, as long as I'm healthy?
I think people are making this almost a bit of a ego, competition. Who can live longer? Who has a bigger goal? Because I heard David Asprey talk, you want to live to 180? I only wanted to live to 150. Well, I won't go too much further on that. But my goal, I think I'll be pretty happy if it's 120. I think I'll be pretty content. But even 100 of great life, that's perfectly good, because I'm ready to go on.
That's pretty cool. I like that. Just in the context of how your answer started, I'm 125, so I'm winning. Is that?
Good for you.
Exactly. It's so stupid. All right. So the founder of Biologics, which is supporting research, and also on your website, you share research using mesenchymal, I think I said that wrong, but stem cells to address frailty, chronic spinal cord injury, diabetic impotence, end-stage liver cirrhosis, cancer, Alzheimer's, rheumatoid arthritis. It's like the who's who of diseases and conditions that are both terrifying, right? And many consider just diseases of aging and currently really don't have any solutions. How do you see stem cells ultimately impacting healthspan and longevity and addressing each of those?
I think it's incredibly inspiring and incredibly hopeful. One reason I'm so optimistic, because we are tapping into intelligence. This is not about, finding a, incredible molecule or incredible herb. We're tapping into what's going on in the DNA. And the code that's embedded in the DNA is what is capable of creating life and repairing life. So when we put that code into another human being, we are infusing intelligence, and that intelligence can guide the body in repair. That's why it's so exciting. Yes, it can become any cells in the body, blah, blah, blah. But it's really the intelligence that these cells can transfer to the body. When we are getting older, we're having less and less stem cells. We're running out of this very potent intelligence to guide the body to repair. But we now can put it back into the body, or we can have other technologies that can activate the cell. So there are different ways of doing this. But right now, the most research, most evidence are these transplantation of these mesenchymal stem cells, or there's some other cell types too, which I incorporate in my practice as well. But mesenchymal stem cells is kind of the gold standard right now. It's very easy to use. They have very little immune kind of irritating properties that actually are immune calming, and they are considered immune privileged. So you can give it from one person to another with very little issues. And then they have this overall signaling effect to help the body regenerate. Not only it can become cells of your body, depending on what types, maybe not all types, but the signaling effect is what's promoting all this regeneration and all the diseases you cited. These are active research from around the world, and the list goes on and on. It's because these signals are that powerful. So, so that's, I think the transferring of the intelligence and tapping into their abilities is what's giving people a lot of hope. And I've seen people coming to my clinic who really had no hope prior. And I didn't even know if I could help them. I have the theory of how the cells work, but I don't have the evidence that it was going to help their particular condition. So it's almost like okay, I'm inviting the patient to be my co-investigator. Let's, use your body as a vehicle to test this out to see if it can work. So it's an experiment. And, there are many times the experiment worked beautifully. And that was because it happens again and again. And that's what's inspiring for me as a doctor to be giving these therapies to patients. But I think there are all kinds of treatments. I think energy medicine is the next stage in medicine. Frequency, energy, I think is incredibly powerful. And stem cells I consider it in energy medicine because of what's going on with the DNA.
And you said the medicine intelligence, like kind of transporting intelligence from one to another, it does have the parallel with Dave Sinclair of the information theory of aging. Like this is an intelligence challenge that we're bumping into, and stem cells may be a key part of that. Is there anything stem cells can't do, or maybe aren't as effective as one would hope, that you've gotten some cases and you're like, I'm not sure this is going to work, and then you just find repeatedly, hey, it's not really good at this, whatever it is?
Yeah, there are a few things. One, if there's a genetic defect, stem cell therapy is not gene therapy. Even though the mitochondria can be transferred from one person to another, in a sense, you're getting fresh new mitochondria, you're getting new mitochondria genes, and some of the cells can stay in the body, so you have some new genes. But, in general, it's not going to fix all your existing cells. It can replace some of the cells, such as when you have autoimmune disease and you do a bone marrow ablation, right? You wipe out all your own stem cells, and then you transplant another person's stem cell. So in a sense that you're getting new genetic material. So yes, in some sense, you can do that. But for particular genetic defects, for particular protein, particular enzymes, and that's going to be very difficult. And the other thing is, what I've encountered in my practice is when there's a lot of mechanical factors in play, such as, for a lot of spine injuries or spinal cord problems. People have herniated disc. If you don't address the mechanical aspect, I can keep giving you stem cells. It may reduce the inflammation, but if you keep exacerbating it and keep, triggering this inflammatory or this compression, then you're never going to be fully repaired. So you need to address, the physics, basically.
That makes perfect sense, right? So if your kind of different spinal vertebrae are not aligned, but they're also injured, and you actually do go in with stem cells and you can repair the injury, but they're still out of alignment, like that's you've got to deal with the mechanical.
Another aspect of the physics is if somebody has a tendon tear, like if it's completely severed, and no matter how much stem cells I give you, the two ends are this far apart, they're not going to find each other. So if it's severely, the lesion is really long, that's going to be difficult as well, for the ends to find each other. But, for a smaller tear, it's not going to be that difficult. So the mechanics is always an important factor.
So I ended up, I poked my son in the chest one day, and I came back and I didn't even really feel anything, but I had a club middle finger. And if you don't know what that is, it's basically the tendon snapped here. And so it was literally hanging like this, and you could lift it and it would go like right back. And my first thought is, because in my mind, these don't repair, but they do, right? So now I'm okay. But at that time, I was terrified that I was just going to have this kind of limp digit for the rest of my life. And so you're saying that stem cells could have maybe sped that recovery up as well?
Right. Absolutely. Yeah. Decrease inflammation and get your cells to function more properly. Right. So it's about communication with other cells and get back to its normal function. But, another thing about mechanics, I just realized, someone asked me, I have receding gum. Can stem cell therapy help me? So my question is, okay, I can inject stem cells into your gum, but how does your gum know it needs to come down a little bit? Because it has already receded. If there's no inflammation and it's a retraction of the tissue, you can inject stem cells, but the stem cells have no signals to know that the tissue needs to come down. But if you cut your gum a little bit and pull the gum down, boy, you inject stem cells in there, it's going to just fill up the tissue right away and repair. I've done that, with patients who just had gum surgery and injected some stem cells. It healed so seamlessly. It looks like there was never surgery done. So it could help you heal. But in some cases, if there's no inflammation and no signal to tell the cells to do something, then the cells are not going to know.
Yeah, that's another kind of physical limitation as you're describing it. Yeah. All right. So I think there's probably lots of myths around stem cells. What are some of the common ones that people need to know are actually myths?
Yeah. So one myth is that you have to use your own stem cells, that's better than somebody else's. In the past, if we only think that the stem cells work by becoming the cells of your tissue, the tissue you're trying to repair, then it will be true. Then it's better to use your own, because your own can differentiate and express surface markers. That will be your own, so your body won't reject. But if you get it from somebody else, they may reject. The problem is that over the last 20 years or so, research have shown again and again and again, the overwhelming mechanism of how these cells help the body repair is not to become the local stem cells. The number of cells that actually differentiate and replenish the local tissue is minimal, but still the tissue repaired and, it fixed itself. So how did it happen? So that's what we know as paracrine effect, that the cells are sending signals to the local environment to promote repair and regeneration and tell the local stem cells to divide. It's your job to become the local tissue cells, right? You have liver cells, you have a liver precursor cells. So tell the precursor cells to divide and replenish the tissue. And that's how the regeneration was happening. So not only that, your own cells are also your own age. So however long you've lived, even if you're only 25 years old, you have had 25 years of exposure to whatever that's going on in the environment and all the junk you've eaten in your food, all the stress you've had and the infections you've had. Everything is accumulating in your body, the oxidative damage, and they're damaging your DNA, and your mitochondria is not as healthy. So all these are happening in the stem cells. It happened to all your other cells, your stem cells as well. So what we found is that younger cells, such as cells from the umbilical cord, or placenta, these young cells are able to produce more growth factors. They're more anti-inflammatory. They're more neuroprotective. They have longer telomeres. They have more generations left. They're just overall are more potent. And they also carry less cancer risks. If you have existing cancer, these cells are not going to promote new cancer unless it's embryonic stem cells or induce pluripotent stem cells. There's no de novo cancer that they're going to generate, the teratoma. So these later cells, from the umbilical cord or from an adult, what they can do is to promote your own cancer that's already been produced, that exists in your body. But when you use really early stem cells, they have the intelligence that's fairly intact. We're all, this is all about intelligence, right? So when the cells get older and get more damaged, they start to lose intelligence. They start not being able to recognize that some of the cells they encounter are pathological, are detrimental to the body, and they need to be gotten rid of, right? They're abnormal. The younger stem cells from the umbilical cord are able to recognize, whereas older cells from like fat or bone marrow have impaired ability to recognize it. So that has been shown in research. So that's one big myth, that people think your own is better. Another myth is that people think more is better, that if you want to get a lot of stem cells, you have to go overseas, because if you try to get a lot of stem cells in this country, unless you enroll in a clinical study, it's not really legal to give people massive number of stem cells that have been expanded. So you can give native cells, but that's just going to be really, really expensive. So manufacturers or these tissue banks, they can grow the cells to huge numbers and give it to patients, but that's not allowed by the FDA. The FDA says that if you want to do that, you have to do it under a clinical study, and that's a cumbersome and expensive process. So a lot of these labs and tissue banks went overseas, where they can grow the cells in an incubator, grow them to huge numbers. So when the patient comes in, of course, it's easy to give them a lot of cells, because literally it's like growing the cells on trees, right? You just, keep producing, and you parcel them off as even though it sounds like a lot, but in your whole pool of cells you just produced, this is a tiny amount. So you just saved yourself a whole lot of money, and you give it to patients. Unfortunately, as the cell divide, especially more than 3-4 generations, they start to have genetic changes. They start to be stressed. They start to have expressions of their own proteins that will be consistent with the donor's genetic expression. So you have not only more chance of rejection, but the cells also degrade and they can become more inflammatory. So this is why I just, shared this case on the American Academy of Integrated Cell Therapy site. This 9/11 responder, he went to Mexico to do treatments because of the lung disease from all the toxic exposures, and he also had some traumatic brain injury. So he got 150 million cells from them the first time and 30 the second time. The first time when he got 150 million, he had extreme fatigue for 2 months. Not only he had the fatigue, everybody that he got in contact with who were at the clinic at the same time, about 20 people, they all had 2 months of extreme fatigue. And then the second time, because he got less, only 30 million, he had, a milder version of the fatigue. And then he found me, realized, I don't have to go overseas to do this. I can stay in the US. And he listened to my YouTube videos and realized, so in the US, doctors like Dr. Kong is using unexpanded native stem cells, and that could be better. So when he got the treatment from me, there's absolutely no fatigue, no side effects. Not only no fatigue, he had increased energy. And instead of getting relief from his lung symptoms in 2.5 months, he found relief in 3-4 days. So this is how different it can be. So this is just a real life example, busting the myth that more is better, that you have to do stem cell therapy overseas. So I think that's the, two other common myths. Another one is that it's illegal in the US, which, is not true. If you are doing unexpanded cells, you're not manipulating the cells, and you're providing the cells, you're giving the cells to the recipient, expecting the same function of what the cells was doing before the transplantation, from the donor, into the recipient, you're expecting the cells performing similar functions. If that's the case, then it's considered a tissue transplant. Not that different from a blood transfusion or organ transplantation. So any doctor who have the license, we're all licensed as physician surgeons, with proper training, we can transplant anything we think is appropriate. So this is tissue transplantation. It doesn't need FDA approval. There's never an FDA approval for liver transplant or for blood transfusion. This is, one person to another. That's within the scope of medical practice. So that's another big myth. But I can go on.
You are enjoying, well, at least I hope you're enjoying the Live Beyond the Norms podcast. Make sure you subscribe, make sure you follow, and make sure you share. But don't be that annoying guy, whatever you do. Don't share it with people who aren't actually interested in living beyond the norms. Well, I think a couple things come up for me. One of them is you're talking about umbilical cord, and I think that may trigger some people. Can you talk about why that shouldn't trigger people? Like, what does that look like? What does that process look like?
It's just so funny. This is like a language issue. It sounds so similar to embryonic. So umbilical cord, embryonic. I even had people who, worked with my company who are mixing the two, saying, interchangeably. Embryonic is, we're talking about embryos, like tiny, tiny embryos. And embryonic stem cells are obtained at day 5 to 7 after fertilization. So this is very early stage. So that's when a little ball is formed from the division of the fertilized egg. And then within the ball, there's some cells inside the ball, and you can take one of those cells out, and that's an embryonic stem cell. And then you can, develop that cell, let it differentiate into any tissue. So that, of course, involves the destruction of an embryo. So for people who are, religious in that sense, that they do believe that that's a life already, and that's not acceptable. But umbilical cord are obtained after a baby is born. So after a live, healthy baby is already born, and usually these cords are cut, right, and put in a bag and tossed into the biological wastebasket. And no one cares what happens to those tissue, except that now we know there's powerful regenerative components in there. So the umbilical cord is obtained from, that nobody's harmed. So there's no ethical concerns there. Of course, there are other countries who are doing fetal stem cells, which in this country, I don't know anyone that does that. I don't think there's anybody that's doing that. But that's not umbilical cord stem cells. It's not embryonic stem cells. That's right in the middle. And I think, it needs to be a little bit more sophistication when it comes to fetal stem cells, but that's the whole other subject. No one in the U.S. is doing that.
Oh, thank you. I think that is what people need to hear if they're having those preoccupations. It's a cross-pollination of terminology. You talked about stem cells actually stimulating the local stem cells to get engaged, and it makes me think. I think I'm aware of people, at least to my understanding, who will get kind of more general stem cell injections that may just go throughout the body. And then I've actually had some PRP done, which I learned has some stem cells in it, right? There's just one of the tiniest types of stem cell end up in the PRP plasma just because of its size. And I've had some of those injections, which are very localized. Does this need to be localized? Is there benefit in kind of a system-wide stem cell, and maybe we can't get enough quantity here in the United States? What does that look like?
Well, I think we have enough quantity. I've seen that in my clinical practice. Even though I'm using a number of cells, that's probably, I would say, 1/5 to 1/10 of what is used overseas. I'm getting just as good, if not better, results. So I think there's enough cell to go around. I do think systemic application is very powerful. This is backed by research showing tremendous improvement in different organs just through systemic administration. And I think systemic possibly will give you additional benefits just by its interaction with the immune system, because you do want the spleen and your peripheral lymphoid systems to be involved to help you heal whatever organ that you're trying to heal. This has been shown. I mean, there's a whole other study, how a stroke victim At the same time, if they had a splenectomy, they actually has less infarct size. So this is not a local issue. The stroke, people think is very localized, right? But if the spleen is taken out, in the short term, the person has smaller infarct size, so smaller lesion, because the immune system is not mounting this attack, sending out all these white blood cells to make things worse. But over the long run, in 6 months or so, the lesion size between people with spleen and without spleen is about the same size. Because guess what? You still need the immune system to repair, right? So the end result is that there's no difference. But because of short, term difference, and you can see the impact of the immune system. So I think you really can't discount that. And I've seen people with various organ issues, because those organs can send out signals to attract more cells. And those will be the places that the cells would tend to, aggregate. They just simply are attracted to inflammation. But yeah, if somebody has more severe condition, I'm going to give them more, because the inflammation, the injury, and all that is toxic to the cells. And they are activated to start working very hard, but they could also die in the process. So, and there's only so much to go around, right? If you give more, you can get stronger effect. But you have to give the right cells, right? You don't give the expanded cells that have degraded. So if you give more of the native cells, then you're going to get more benefit. Actually, there was one study that I showed in one of my presentations showed that. You get more cells that are native cells, you get a heightened clinical response. But if you get 10 times this, higher number, but it's expanded cells, you end up having less clinical effect. So 10 times the number of cells with less clinical effect. So more is not better. You just have to find the right type of cells.
That goes back to the intelligence, or that kind of information, right, theory of aging, where as these are reproducing, as they're duplicating, they're potentially losing some of the valuable information that is actually what's being imparted. And actually, kind of thinking about one of the interviews I listened to, I think you're actually doing system wide, right? You're not coming in and injecting stem cells into a shoulder blade or anything. You're actually doing systemic.
I do both. Yeah. I do a lot of local injections as well. Yeah. Because you are going to get more cells if you inject locally. So there's no way around it. Mm-hmm. So you put a pool of cells in that area, you are going to get more signal. So we can target. But also some places have such poor exchange with the blood. So whatever I put systemically into the blood is going to have a hard time get to that location. One example is larger joints like the knee and hips. You really would do better if you just put cells right in the joint capsule, because otherwise it's going to take months for the information from the blood to get to the joint capsule. Or the other thing is the blood-brain barrier. Well, the systemic is still, there are different doctors who are doing different things. And we're talking about a little bit more invasive. People can put in the spinal canal, or you can use things to open up the blood-brain barrier to allow more cells to get in. But injecting into the brain tissue itself, that's a little risky. It can be done, but there's definitely more side effects.
Yeah, I think any time you start talking about injecting in the brain, people are like, that sounds like research more than it sounds like solutions, depending on the situation, right? And I think it makes sense that you do both, right? If there's systemic value, do you often, when you're doing a treatment, do you do like both at the same time, or is it just dependent on what the particular needs?
Yeah, at the same time.
Okay. So if I've got a knee pain, which I do, and if I got an elbow pain, which I also do, then you might inject both in my knee and my elbow, and then also do a systemic injection or into the...
Yeah. A lot of times, if a person is really, pretty young, pretty healthy, and they just had a sports injury, I could just do a local injection, and they could do pretty well. But if a lot of people with, for example, osteoarthritis, it's a chronic condition. It's a degenerative condition, inflammatory condition. And that has to do with your body not being able to keep up with the repair. So they will get better results if I give them both systemic and local injection. Even just considering the fact that the cartilage, because osteoarthritis, has to do with the cartilage degeneration. The cartilage, the outer 1/3 of the cartilage in the knee joint is nourished by the blood supply. The inner 2/3 is nourished by the synovial fluid. So it's better to attack from both angles, even if you're just looking at that particular cartilage plate.
Interesting. You mentioned mitochondria earlier, and it just caused me to think, is there any research on stem cells and their impact? Do they impact? I mean, we're talking about inflammation, mitochondria with the reactive oxygen species that they can spit off. Like this is all kind of folding in together. Do you have any comment about stem cells and potential impact on mitochondrial function?
The only thing I can think of is, of course, it can help reduce inflammation in the body, and the inflammation will be damaging to cells and to mitochondria. It's going to be more and more oxidative stress. But another exciting thing that, another reason I love these perinatal stem cells is because they carry these very young mitochondria, right? Very early stage, hasn't been divided very much, hasn't lost its potency, because the umbilical cord stem cells really is a very special category of stem cells, because it's not the same as the baby's stem cell. We think, oh yeah, it's 0-day-old, stem cell. No, this is way younger than the baby stem cells, because when the embryo is forming, a lot of these young stem cells are trapped in the umbilical cord. So they're in between the baby stem cells and the embryonic stem cells. So they are even earlier, and you talk about mitochondria, they're even, more primitive and more protected. So when we put those cells into the body, they have had research, even captured with imagery, showing through electron microscopy that mitochondria was traveling across a microtubule from the donor cells to the recipient cells, so elevating the energy of the recipient cells. And not only can do that, traveling across the microtubule bridge, it can also, the cells do all kinds of ways. You can spit the mitochondria into the, into the interstitial space, and the mitochondria can be incorporated by another cell, or send it out through a big vesicle, and that gets fused into another cell. So the cells do all kinds of interesting things. So in a sense, you're getting mitochondria transfer. You're getting fresh new mitochondria. So I think, yes, it can be very helpful.
Very, very valuable. All right. So I have a couple of questions that I ask kind of to wrap up each talk. One of them is, what are the 2 to 3 protocols, habits, mindsets, let's call them shortcuts because everybody likes shortcuts, to longevity and a long health span that you can share?
Well, of course, one of my favorites is the stem cell treatment. So that's the one I've been pretty consistent on myself. Every 3 months, I do an IV stem cell treatment on myself. And what's fun is that, I could see the difference it made on me. I mean, the most drastic is just looking at photos from, 7 years ago before I started. Actually, I think, 9 years ago. That was when I was much younger. But then I look a lot younger than I was 9 years ago. And that just doesn't happen, in nature. And of course, the research on animals have shown that's what's going to happen. It's going to extend your lifespan by about 30%, at least in rats and mice. And not only they are living longer, but they just look so much better, and they're moving so much better, and they think so much better. So that, I think it's definitely a great shortcut. We have patients come in every 3 months or 4 or 6, depending on, some on finances. Then they come and kind of dial back the clock. So I think that's one powerful way of longevity and biohacking. And the other one, one of my favorites is peptides. So peptides are, powerful new signals that we have discovered that's going on in the body, and there are, numerous of them, and we're only beginning to tap into the potentials. So I think those are some of my favorites. Of course, the other ones, sleep, exercise, and be happy and have a community, all those are very important. Yeah.
Yes. Do you have a favorite peptide?
I guess the most common was BPC 157, TB 500, because they hit so many organs all at once, and they just cover a lot of ground. But what else do I? T alpha 1 is wonderful too for immunity. Yeah. Very
cool. And you mentioned a 30% extension of life in some animal models. Was that with ongoing stem cell? Like you said, your kind of protocol is every 3 months, quarterly. In that particular experiment, was it ongoing? How often were those animals getting stem cell injections?
The animals didn't live very long, right? Their average lifespan was about 20 months. So they were giving them every 2 weeks. So that's, you adjust, the frequency according to their lifespan. So every 2 weeks, not only they were giving, one experiment was giving rats that were middle-aged. So they start giving them stem cells, and that's showing that their lifespan is extended by 30%. There's another experiment that was giving to, I forgot rats or mice, but they were given stem cells at the human equivalent age of 75. So they're elderly rodents. And when they started giving them stem cells regularly, it turns out that the ones that got the stem cells versus the control, the one that got the stem cells, the time remaining from the time they got the stem cells were 3 times as long as the ones that never got stem cells. So it tripled the amount of time they had left on Earth, basically. Yeah, so that's very valuable for people who are already older. Would you like to triple the amount you have left?
Yeah, I think as you get closer to that finish line, maybe both you and I change from 120 to 125, and that gets pushed out farther if if that's as we get closer.
Oh yeah, I'll double up.
Mindsets change at that. All right, Dr. Kong, how can people get a hold of you and kind of find your research and find out about you? I know you have a podcast. What's the best way to make contact with you?
Yeah, so, 2 ways. One is follow me on YouTube. So just Joy Kong MD, just look me up. I have a lot of really helpful videos going to different aspects about stem cell therapy, including the timeline, the different stages of treatments, and what about other people's DNA in your body? What about treatments in Panama? What's the difference between what we do here and what, just a different aspects. So that's a really good place. The other one is just my website. I have, this website, joykongmd.com or drjoykong.com, covers all the things that I'm into, my clinic, the stem cell company, the academy, my memoir that's on Amazon called Tiger of Beijing, and the cream I created called Chara Omni, which is a stem cell cream that's 100% natural. So it's got all these things that I'm involved in. So that would be a good place to catch me.
All right, excellent. What in the near future are you excited about?
I'm super excited about bringing in more stem cell products and more innovation into the world and getting it out not to more doctors in the US, but around the world. That's what I'm super excited about.
That's excellent and shown by the research that you're doing. All right. You can find her joykongmd.com, joykongmd.com. Dr. Kong, thank you so much for joining us on this talk, and we look forward to staying in contact.
Thank you so much for allowing me to share the information. You're a great interviewer. Thank you so much, Chris.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.